Complex post-traumatic stress disorder, or complex PTSD, originated in the early 1990s, is a disorder that occurs when the patient experiences similar traumatic events as those with PTSD, but repeatedly. Some of them are staying in war zones or being a prisoner of war, being a victim of torture, violence, kidnapping, slavery, trafficking, childhood neglect, physical, sexual, emotional abuse, and long-term exposure to domestic violence or abuse. As a result of these repeated traumatic experiences, not only do complex PTSD patients have a longer, tougher, and more complex healing journey, but they also have additional symptoms that PTSD patients don't exhibit, such as depressive feelings that may lead to self-harm or suicidal thoughts, physical pain, relationship problems caused by a lack of trust, and self-esteem issues, including constant feelings of shame and guilt. Since this is a relatively new diagnosis category under PTSD, tests are few and far between. One approach is by keeping track of the symptoms, starting date, changes, frequency and intensity, and the triggers. Another is by utilizing the International Trauma Questionnaire. The International Trauma Questionnaire, or ITQ, is a self-report questionnaire with 2 subscales, 3 symptom clusters each, and 18 questions in total. The first half is symptoms for those who may have PTSD, while the other is for those with complex PTSD. Since PTSD most likely affects one's mental health, any mental health professional may use this test for complex PTSD and utilize this test for their practice. To use our free ITQ test for complex PTSD patients, follow these steps. Download our ITQ test from the Carepatron platform, which you can find in the link in the description. Firstly, before providing them with a test, it's best to consult with your patient to not only know what's troubling them, but also to gather medical history and conduct other tests to eliminate other diagnoses such as borderline personality disorder or any other personality disorder. Next, conduct the test. When it's time to conduct the test, you have 2 options. Give the patient the copy of the template to answer, or guide your patient by having them answer the test verbally while you write down the answers and score. To score the ITQ, simply tick the appropriate box according to the patient's answer and how bothered they are by the problem mentioned in the items. Generally, if the problem doesn't disturb your patient, give it a 0, and if it greatly affects them emotionally or even physically to the point of interfering with their daily life, score it a 4. Here's a sample to help you picture how this tool can help you diagnose your patient with complex PTSD. You can view this on our Carepatron platform by clicking on the link in the description. To find our ITQ for complex PTSD patients, go to our Carepatron platform or click on the link in the description. In our template section, we have a variety of templates and worksheets for you to use with your patients. You can filter or type in the keywords to find the worksheet. Thank you for watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel or click on one of our recommended videos.